Hello, everyone. I want to help you guys understand the high cost of healthcare in America. How much is leaving your wallets for high healthcare coverage? What is the average someone pays per year for health insurance? Who's willing to pay higher taxes for free healthcare? Well, I have received VA healthcare and the system is not that great. So I did my own research to see how much I can or how much would I have to pay for health insurance in the civilian sector. So on average, I was quoted at $650 a month. That's just ridiculous. So I had to sit back and do more research and get more of an insight on to why healthcare was so high in America. Hello, my name is Warren Nelson. So today I'll be going over a couple of topics. One, types of healthcare. Two, the price of healthcare and prescription medication. And three, the factors of the high cost of healthcare. So the first category that we're going to talk about is health or types of health insurance. First, you have dental, vision, and medical. With dental, you have dental discount payments, you have PPO and prepaid dental copay plans. Next, you have vision. Vision entails eye examinations, dealing with glasses and contacts. Next, we have medical. Medical involves Medicaid, Medicare, and private insurance, and etc. Now that we talked about the types of health insurance, let's talk about the price of medication and the cost of treatment. So in America, on average per person, we're paying $1,200 in prescription medication a year. Cancer treatment comes down to paying $10,000 a month. That's just ridiculous. So the highest prescription medication used in America is Norco, which Norco is a pain medication that each pill costs $14. Then next we have gabapentin. Gabapentin costs $11 a pill. And what's the cause for the high prices of prescription medication? Well, it's the corporations raising the prices. So a couple years ago, there was a new HIV/AIDS drug that came out on the market. And when it first came out on the market, it was $13.50. After a few short couple of weeks to months, the price rose to $750 a pill. In 2012 through 2016, insulin doubled in price from $2,600 to approximately $2,800, so a total of $5,800. The supply and demand in the US rose 3 times over the last decade. And what is the biggest cause of any product raising in price? The brand name. So moving on from drug prices and treatments prices, we're going to talk about the factors of healthcare costs. So the factors of the high costs are actually pre-existing injuries, greed, and legislation. First, pre-existing injuries have to deal with family health history, lifestyles and habits, and abusers of prescription medication. Next is going to be greed. Insurance companies with the high premium cost and the hospitals charging 300 times what the product that they paid for. Next is going to be legislation towards high cost pricing. Lobbyists, government regulations which cause competition, which causes the price to rise. So really, to conclude, there's no one reason why healthcare is so high in America. There's multiple reasons, from politicians to pharmaceutical monopolies. Prices of medical equipment, prescription medication, and health insurance will continue to rise in the foreseeable future. There's no reason why, or it's a reason why some do not want to pay for health insurance unless it's a last resort. So if you want more information, you can go on accessiblemeds.com, bloomberg.com, or businessinsider.com, and finally cnn.money.com. Thank you, and I hope I gave you more of an insight to the high cost of healthcare in America. Thank you.